Hello everyone. So today we will be starting our discussion related to AIPGT homeopathy to introduce all memory based questions. Okay, so let us start. First question is asked about swan neck deformity, which is classically associated with swan neck deformity. As we know, it is associated with rheumatoid arthritis. What happens in swan neck deformity? There is hyperextension of PIP joint with flexion in DIP joint. Usually, it is found in chronic rheumatoid synovitis. Okay, in swan neck there is PIP का हाइपर एक्सटेंशन DIP का फ्लेक्शन. और रोमेटॉइड आर्थराइटिस में दो डिफॉर्मिटी होती है, एक स्वान नेक डिफॉर्मिटी, एक होती है बॉटरनियर डिफॉर्मिटी. बॉटरनियर डिफॉर्मिटी में इसका जस्ट अपोजिट होता है, पीआईपी में फ्लेक्शन हो जाएगा और डीआईपी में हाइपर एक्सटेंशन हो जाएगा. ओके. फिर पूछा गया है वायरल मेनिंजाइटिस, व्हाट इज यूजुअल सीएसएफ पैटर्न. तो क्या होता है, लिम्फोसाइटिक प्लियोसाइटोसिस एंड नॉर्मल ग्लूकोज माइल्ड राइस प्रोटीन. बेसिक कंसेप्ट क्या है, वायरल मेनिंजाइटिस जनरली प्रोड्यूस अ क्लियर सीएसएफ with predominant lymphocyte. Glucose is usually normal, unlike typical bacterial meningitis. So in viral meningitis, there is normal glucose and lymphocyte. Okay. Tetralogy of Fallop consists of. So what is tetralogy of Fallop? There is VSD, pulmonary stenosis, uh, over overriding aorta and right ventricular hypertrophy. The severity of cyanosis depends mainly on the degree of right ventricular outflow obstruction. Okay. Dowson finger are characteristic of which disease? So Dowson fingers are characteristics of multiple sclerosis. Dowson finger क्या होती है? It is elongated ovoid periventricular plaque oriented perpendicular to the lateral ventricle. Okay. What is severe acute respiratory syndrome? That is SARS. It is caused by which pathogen? It is caused by a coronavirus, that is SARS-CoV. Okay. What is basic difference between nephrotic and nephritic? In nephrotic, as we know, there is protein plus edema. In nephritic, there is blood plus inflammation. Nephrotic syndrome, there is heavy proteinuria, hypoalbuminuria, edema, hyperlipidemia. In nephritic, there is hematuria, hypertension, reduced GFR, oligouria, and inflammatory granular injury. Where do you see a spider leg deformity or spider leg appearance? So, we see in Marfan syndrome, spider leg. In kidney, we see it in polycystic kidney disease, autosomal dominant. What is significance of Crushman spiders and carrot ladens? So हमने पढ़ा है ये अस्थमा में मिलते हैं, अस्थमा में हमें 3C मिलते हैं, तो उसी में से 2C हो गए, क्रशमैन एंड कैरोट लेडन. What is preferred definitive imaging mentioned for एम्फाइसेमा? तो एम्फाइसेमा को अगर हमें देखना है डेफिनेटिव इमेजिंग टेस्ट, तो क्या होता है, सीटी स्कैन. इट इज़ अ हाई रेजोल्यूशन सीटी. Trigeminal neuralgia associated with herpes zoster is due to involvement of trigeminal nerve, particularly ophthalmia division. Okay. Gamma is characteristics of which stage of syphilis? Gamma is characteristics of tertiary stage of syphilis. What is gamma? Gamma is a granulomatous destructive lesion of late syphilis. A 46-year-old XY phenotypic female appearance and absent of undeveloped uterus suggest of which condition? It suggests of androgen insensitive syndrome. Basic concept is what? This XY individual have testes producing testosterone and anti-Mullerian hormone, but tissue cannot respond to androgen. So anti-Mullerian hormone cause absence of Mullerian structure, while androgen resistance cause female external phenotype. Okay. In diabetic ketoacidosis, which finding is not expected? In diabetic ketoacidosis, metabolic alkalosis is not typical acid base disturbance. What is common cause of right ventricular failure? So in right ventricular failure, we can think of pulmonary hypertension. Which homeopathic medicine are classically compared for injuries? Arnica and Ruta. With Arnica and Ruta, we also compare our Calcarea phos. Okay, Arnica and Ruta are for trauma remedies. Arnica is for bruising, whereas Ruta is specially associated with periosteum tendon ligament. What is common name of Arnica? Common name of Arnica is leopard's bane or mountain Arnica. Which remedy is traditionally associated with recall with prolapse with parturition? Prolapse with parturition, we remember podophyllum. Which homeopathic remedy is strongly associated with toothache? So toothache we remember Mac carb, uh, Thuja, different remedies which is associated chamomilla. Which remedy is associated with sago like palm? Sago like palm we know phosphorus. Which remedy are listed as an inimical? So we know belladonna and dulcamara are inimical. RT and Apis are inimical. Which two remedies are given in the recall is being used alternatively? Thuja and nitric acid are used alternatively. Which remedy is associated with sound echo, restless, and fidgety feet? Fidgety feet we have phosphorus. Which remedy is associated with sago particles? We have discussed is phosphorus. What is a key materia medica association with carbolic acid? So for carbolic acid we know there is it can cause burning, it can cause whitening. Okay. Which remedy is associated with arnica followed by symphytum? It is calcarea phos. What is associated with abrotenum is simplified recall. So in abrotenum we remember what, uh, rheumatism after suppressed of diarrhea or alternating with diarrhea. What is key statement of Agnes Castus? Which remedy is associated with sweet sweat attract fly? It is what? Caladium. Toothache, can the exact answer be determined to split? What is important materia medica identification for Stilago? If incidence among smoker. Vitamin B12 deficiency is classically caused megaloblastic microcytic anemia. What is Mission Indradhanush? Mission Indradhanush is an intensified immunization initiative aimed for increasing full immunization coverage among children and pregnant women. Define TTR, GRR, and NRR. TFR is what average number of children and women would have been over reproductive age at current specific fertility rate. GFR is average number of daughter a woman would bear. NRR is average number of daughter a newborn girl would bear if current fertility and mortality rates. What does ART mean in HIV management? ART is what? Antiretroviral therapy. What is Sullivan index? Sullivan index is what? Disability free expectancy using current age mortality and disability prevalence. Step-ladder pattern of fever is found in typhoid. What is KFD? KFD is for Kirschner forest disease, tick-borne viral hemorrhagic fever caused by Kirschner forest disease, that is flaviviridae. What can measles spread to other? So we know measles में incubation period होता है rash के 4 दिन before और 4 दिन बाद. In which year was the first adult immunization was introduced? It was introduced in 2002. What is JSSK? It is Janani Shishu Suraksha Karyakram. Janani Shishu Suraksha Karyakram. What is the main hormone associated with cervical ripening and relaxation of pelvic tissue during pregnancy? It is relaxin. How many ova are present in ovary at birth? So at birth we have 1 to 2 million primary oocytes. Which operation is classically used for uterine prolapse? We use Manchester operation or Fothergill operation for uterine prolapse. What is paretograph? Paretograph is a graphical tool used to monitor labor progress and maternal fetal condition. What is abruptio placenta? That is premature separation of normally implanted placenta after 20 weeks and before delivery. In infertility with male oligospermia and low motility, what will we generally consider? We will generally consider intracytoplasmic sperm injection. What is preeclampsia? That is new onset of hypertension after 20 weeks of pregnancy with proteinuria, organ dysfunction, and attribute to pregnancy. What is the streak ovary associated with? Streak ovary is associated with gonadal dysgenesis, classical Turner syndrome. That is 45X. Which hormone helps in cervical softening and uterine preparation for labor? It is prostaglandin, which helps in major mediator of cervical ripening, whereas relaxin produce relaxation. What is Kent 8 observation? What is meant by secondary curative action? The action of vital force in response to primary medicinal action, producing the curative